Hey friends, welcome back to another video. Apologies for not uploading sooner. I was actually away on a much needed vacation throughout the month of July, but I'm back and ready to start filming again. In today's video, I wanted to give you a little recap of everything that we covered during my first year of medical studies at McGill University. So if you're watching this video, maybe you're someone who's interested in medicine. Maybe you're someone who is starting medical school, and if that's the case, congratulations. Or maybe you're a medical student that just wants to get an idea of how medicine is taught at a different university. So regardless of where you are in your medical or non-medical journey, I hope you enjoy this video. So as I've mentioned in a previous video, McGill's medical curriculum, at least for the first year and a half, is done in blocks. And in the first year, we went through 8 different blocks. So from block A to block H. So block A, which was also called From Molecules to Global Health, was an excellent introduction to medicine, specifically focusing on public health. Public health looks at the various ways that we can prevent disease and improve the overall quality of life of the Canadian and worldwide population. It's during block A that we were introduced to our small groups that we have maintained throughout year 1 and will continue to maintain until midway through year 2. It's within these small groups that I have already gained so many valuable friendships that I believe will last me beyond my medical studies. So throughout the entire year, I would say that there were on average 1 to 2 small groups per week. And during these small groups, like I said before, we'd be a group of 15 students that would go over various cases and scenarios with a private tutor. And this private tutor was typically a medical resident or fellow specific to the block that we were studying. For example, if we were in the cardiology block or block C, then our private tutor was a cardiology fellow. And the entire point of this small group, other than to make friends, was to reinforce the material that we learned during the lectures. So for that reason, I think it was really useful because we actually took the theory and put it into practice by using realistic case scenarios. So in block A, we also had a community group project that we had to complete. This project allowed us to become more aware of the various and many health discrepancies in our country from the get-go, from the beginning of medical school. And these health discrepancies are even more prevalent in marginalized populations, unfortunately. Now, Block A concluded at the end of September with our first of many finals in medical school. So right after that final, we jumped into Block B, which covered the entire respiratory system. So in this block, we were introduced to the cadaver labs, which helped us optimize our learning of anatomy and physiology of the various organ systems that we covered throughout the year. Of course, the first being the respiratory system. It was in that moment where I officially accepted the fact that I was in medical school.
You're a wizard, Harry.
So although Block A was a great introduction to the field of medicine, Block B is where the material, or the amount of material that you needed to memorize and understand and appreciate became somewhat overwhelming. But that is what is expected of medical school, is it not? So at this point, all lectures were still conducted on Zoom given the COVID situation, but McGill started to introduce the in-person activities such as the small groups, the cadaver labs, and of course our final exam unfortunately had to be written in person. So after another month of the respiratory system, by the end of October, we jumped into Block C, aka cardiology, aka probably my favorite block of the year. So Block C was the longest block of the year. It was 6 weeks instead of 4 weeks. And it was also the first in-person block because the COVID situation got a little better until Omicron hit. But it was my favorite block because of the super fascinating material. Cardiology is a well studied field. There's a lot of research and money that has been put into cardiology, and it shows. But also, we had amazing lecturers, and our block leader was probably my favorite. Shout out to Dr. Walker, #1 block leader. So the cardio block wasn't so different from the respiratory block. We still had to go into cadaver lab. We still had our small groups. And we did have a midterm, however, this time, because it was a longer block. Half of it was split into the midterm and the other half was in the final. But the difference is that at the end of the cardiology block, we had what is called a RNE week, which stands for reflection and examination. So there are a couple of those throughout the year, and that was the first one. So the RNE week is basically a week of finals. So in this first RNE week, we had the cardiology final. We had an anatomy lab exam final, which consisted of everything we learned in the cadaver labs in Block B and in Block C. So on the respiratory system and on the circulatory system. And we concluded that week with an RNE exam, which is basically a exam that covers everything we learned in medical school up to date. So after that RNE week, we had a short but well-deserved 2-week Christmas break, and then we jumped into Block D at the beginning of January, Block D being the renal system. Now, the COVID situation was not great because Omicron, I can't pronounce it like that, Omicron was at its peak, and unfortunately everything was moved online again. So the entire block, which spanned the month of January, was completely online. Fortunately, there were no anatomy labs, so we didn't miss out on anything there. But at this point, we were pretty much used to the whole online format, so I like to think that this block went fairly smoothly. So the next block was another long block. Block E started at the end of January and went all the way until spring break at the beginning of March. And this was Block E, which was the digestive system. So this block was not a fan favorite for most of my peers, primarily because of, I would say, the amount of sheer material and the difficulty in organizing all of that material in a digestible, no pun intended, fashion, right? So if you think about it, the GI tract is huge. It starts from your mouth and it finishes with your rectum, or anus specifically, and it covers all the organs in between, right? So you have your esophagus, your stomach, your small intestine, your large intestine, and all the accessory organs, you know, your liver, your pancreas, your spleen, so on and so forth. On top of that, endocrinology was also covered in that block. So endocrinology, you know, which looks at all the various hormones. You talked about your thyroid gland, your thyroid hormones, parathyroid hormones, cortisol, etc. So it was a very, very heavy block. On top of that, we also had the cadaver labs that were all done online. So that was a very different learning process, and I would say that it was a very difficult learning process to learn anatomy online when you're used to looking at the cadavers and getting that 3D shape. McGill did its best with online tools to optimize the learning experience, but I would say that nothing beats the in-person live experience. So that was kind of a vibe kill. So at the end of Block E, we had our second RNE week right before spring break. So we had the GI final. We also had a midterm prior to that, but we had our GI final in that week. The anatomy lab final, which was in person but on a computer. So it had 2D images of 3D structures, so you can imagine why it was not a fan favorite block. And we had our RNE exam again. This time the RNE exam consisted of material from Block A to Block E. Mostly focusing on the last two blocks, but still had material from everything we learned up until now. So after spring break, we jumped into Block F, which was called Defense. And this was the immunology block, but it also contained dermatology and hematology. And there were only 4 weeks in that block. So to cover these 3 main medical fields and only scrape the surface because you're trying to fit that all into a 4-week period, to me, it was a very information heavy block, and I don't feel like I gained the full appreciation of each of those fields because it felt a little rushed. But in the following block, in block G, which was the infection block, I thought that having that immunology, dermatology, hematology background really allowed us to appreciate the next block, which, like I said, was infection. So when we talked about all the infectious diseases, we covered bacteriology, virology, parasitology, mycology, and so on and so forth, again, in the span of 1 month. At that point, I felt like we got a better grasp of, the various antibiotics we could use, the antivirals and antifungals. Because we talked about some of these drugs throughout the year, when we were in the cardio block, we talked about, infective endocarditis. So that's like a bacterial infection that infects the heart. We touched on that at the beginning, and then we really came back to it and solidified some of the material that we learned earlier on in the year in this block. So for that reason, it was one of my favorite blocks as well. So the final block of the year, which started around Victoria weekend and finished mid-end June, was the musculoskeletal block, so MSK or block H. And as you may have guessed, this block, about half of it, I would say, was primarily anatomy, and the other half talked about the different musculoskeletal diseases and treatment options. What was cool about this block is that there were physical exam sessions where you learned, you had a physiotherapist tutor, and you learned the various movement and exams that test for muscle weakness or damage or tearing or bone injuries. And this allowed us to reinforce the anatomy. So by doing a specific movement of the rotator cuff, let's say, we can tell which muscle is damaged or which ligament is not intact, or if, let's say, a bone is out of place. I mean, we're no experts, but that was the whole point, is to reinforce the anatomy that we learned throughout the year. And to further reinforce the anatomy, I feel like we were in the anatomy lab almost every day. We went through all the upper limbs and lower limbs, from, I would say, from shoulder to the fingertips and from your glutes to your feet. And this allowed us to really reinforce the anatomy, the muscles, the vasculature, the nerves, and so on and so forth. And of course, to cap off year one, they had to throw a nice long R&E week with 4 exams instead of 3. So this time you had the MSK final, which fortunately was on a Friday, and then we had a weekend to kind of like recuperate from that. But then we had our anatomy lab exam for the entire upper limb and lower limb. Plus we had an ultrasound OSCE. So another thing that I didn't mention, throughout the year, we would go into McGill Simulation Center and do ultrasound scans on real patients. So that was really, really awesome. And we had to basically do an OSCE exam on all the knowledge that we acquired during these ultrasound sessions for that exam. And finally, you guessed it, we capped off year one with an R&E exam that encompassed everything we learned from block A to block H, primarily focusing on those last 3 blocks, so defense, infection, and MSK. And that's it. That was year one. That was just a brief summary of what we covered in year one. One thing that I forgot to mention that was happening throughout all of these blocks, and I've said this in a previous video, was our longitudinal family medicine experience, also known as LFME. So throughout the year, we were shadowing about once every 2 weeks, I would say on average. We'd go shadow a family doctor in various different settings. Some people had it in clinics, some were in hospitals, some were in very urban settings, some were in more suburban settings, all within the general region of Montreal. But the point was to introduce us to family medicine and be able to reinforce some of the material that we learned throughout the year. So looking back at year one, I'm really, really grateful for all the friends that I've made, as well as all the lecturers and tutors and physicians that I have encountered up to date. You know that ancient Greek proverb that goes, "All I know is that I know nothing," by Socrates? Well, that's how I felt after my first year of medical school. Even though I filled my brain with a tremendous amount of information, I still only appreciated the surface of the field of medicine. It's as if I dipped my toe in a giant ocean of information. But throughout this year, McGill really reinforced their motto, and that's patient at heart, science at hand. The way they did this is by emphasizing the importance of evidence-based medicine, all while approaching a patient in a scientific but also humanistic manner. Now remember, everything that I just said is a very superficial summary of all the main topics that were covered in year one medicine at McGill University. Now, although I really don't want summer to end, I'm also really excited for my second year in medical school and what it has to offer. And I hope that you will continue to tag along with me throughout my medical journey and that you enjoyed this video. Please don't forget to like and subscribe. And if there's something that you'd like to see on the channel, just let me know in the comment section. As always, I will catch you in the next one.